Welcome back to Indiana Newsdesk. State health officials confirmed this morning Indiana has its first case of the coronavirus, and it's in Marion County. The governor quickly responded, declaring a public health emergency. As concerns grow about the coronavirus outbreak, we asked you for your questions about it. Right now, Graham McKean, who is the Assistant University Director of Public and Environmental Health at Indiana University, joins us to get some answers. You know, this is a rapidly changing situation. Can you give us just a little bit of an update of what's happening right now?
Well, a lot of things, obviously, and last check before we went on air here, there's 245 cases confirmed domestically in the United States, and as you just said, our first case in Indiana was confirmed about 11:15 this morning in a press conference. That case, we believe, was imported from the state of Massachusetts. The individual went to a biotech meeting near Boston, which had 3 other confirmed cases, and so while we were expecting this, that is our first case, and I think we're going to be expecting more cases, as many health officials have said.
Okay, so we know this is something that can be spread without symptoms, but how long is someone contagious for?
That is something we still do not have a firm answer for. Now, we are learning that the number of asymptomatic cases is actually quite low. They think maybe only about 1%, but we still think that this can be spread pre-clinically before you show symptoms. And so in that regard, it does kind of spread like the flu, but we don't exactly know how long your entire infectious period is.
All right. Another question we received, right now the numbers of people who die from the flu is many more times than the COVID-19 virus. What makes it more dangerous?
Well, that's a great question, and when we talk about the flu, we got to think of terms of scope, right? I think we're probably about 35 million cases estimated of the flu in the United States, and probably over 20,000 deaths already. Now, we've just passed 100,000 confirmed cases of this virus, and what's concerning about that to me is currently the case fatality rate based on these numbers is about 3.34% globally. The seasonal flu in the United States kills 0.1%. So this is much more deadly than the flu. Now when we learn more and we get more cases, I think that denominator is going to widen a bit. So I think the actual fatality rate is lower. And I think in developing areas, it's probably less than 1%, but I think our main concern is up to 4% in some of these developing areas.
Okay, and then we have time for one more quick question. What's the latest on the availability of testing kits in Indiana?
In Indiana, the State Department of Health does have a test kit available now. They are producing tests rapidly. We're supposed to get about 1.5 million out in the next week, but right now the demand is exceeding supply.
All right, thank you very much for being here. I'm sure there'll be much more.
There will be, thank you.
Thank you.